Good afternoon. I'm David Sweat, Deputy Director for the Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint Task Force news briefing for the COVID response. We have today 29,797 people who have been diagnosed with COVID-19 disease in Shelby County since the epidemic started. That represents an increase today of 293 cases that were reported yesterday. It's a very large increase, and this is something that we have been saying all along we wanted to monitor because we are now more than a week away from Labor Day, and we did not know, but we wanted to find out whether the celebrations and gatherings associated with Labor Day might add energy to the epidemic, and also we were monitoring for what possible impact could be seen from the schools reopening. What we are seeing this week is that there has been an increase in the number of cases reported, and as of today, we have averaged 164 new cases reported per day over the last 7 days. We've also seen 429 deaths reported in Shelby County. So at this point in time, we continue to monitor those trends and other data points. And the Director Haushalter, who is with us today, will speak to some of the decision-making processes that will go into the future. We're also joined today by Mr. Lopez from one of our local radio stations to help us promote some testing events that the Shelby County Health Department will be hosting this weekend. Now, in terms of other data, we have some slides that I'd like to call up now, please. So we have been able to expand our understanding of testing in Shelby County, and we are beginning to report that information, that broader understanding of testing volumes. And what you see here on this slide is a representation in the first column, the number of people who have been tested, either positive or negative. And we have, as I've reported, 29,797 people who have tested positive in Shelby County. Now you also see in the right column the number of tests. And so some people have been tested more than once. And in total, we've actually had 413,586 different tests reported to us from March through yesterday in Shelby County residents. And the 2 points that I'd like to make about that are, when you calculate it, that represents more than 28% of the population has been tested at least one time, and there are some people who have been tested several times. And that points us once again to the fact that in Shelby County, we have widespread availability of testing. And in fact, we have over 10,000 community-supported test slots available, appointments in community sites for people to come in to be tested. And so there is good access to testing. Many of our citizens are taking advantage of those testing opportunities. And we would encourage everyone, if you are having symptoms of COVID-19 disease, or if you've been exposed to somebody, you're a contact to a case and you want to see whether you have become infected, because people can be infected without showing symptoms, that we want to remind you that testing is available and that plenty of your neighbors have taken advantage of that opportunity, and we would encourage you to do so as well. In terms of other statistical things that we want to cover today, I want to point out that the distribution of our cases has had a disproportionate impact on our minority populations. So we've seen that throughout the entire epidemic, but we are over 79% of our cases have been diagnosed among people who are either African American or Black or Latino, part of the Latinx community. And because this is Hispanic Heritage Month, we will be offering an enhanced number of opportunities and outreach testing events to our Latinx community, and those will be highlighted once again later in the briefing. In the next slide, please. We see that our children are also represented here. Overall, 9.5 or about 10% of the cases that have been diagnosed are pediatric cases, meaning they're less than 18 years of age. But once again, our minority populations are bearing a disproportionate share of cases among children. So in the testing events this Saturday and Sunday, we are offering testing to people, anyone 13 years of age and older. And so we certainly would encourage any of our school-age children in middle school or high school who need to be tested, that they certainly could come out and be tested in the test events this weekend. Now, in terms of our deaths, we continue to see that certain risk factors have increased a risk of death. And there are 5 that we have mentioned repeatedly, and I want to call your attention to them again. If you're 55 years of age or older, that in and of itself increases a risk of death. Also, if you're obese, if you have diabetes, if you have an underlying respiratory condition such as COPD, emphysema, asthma, or any other lung-damaging disease, that all increases your risk of death. And the most important increased risk factor for mortality is heart conditions. That includes even having high blood pressure. So if you're on maintenance meds for high blood pressure, or you have ever been recommended to be on maintenance meds for high blood pressure, you're at increased risk for mortality. Also, if you have been diagnosed with heart disease of any kind or any sort of cardiac condition, that is an elevating risk factor. And that means that if you were to acquire COVID-19 disease, that your risk of death from it would be greater. So for all these reasons, we would encourage all of us, with over half of our cases being less than 54 years of age and over half of our deaths being more than 55 years of age, we would say everyone in the community has reasons to follow the precautions that we outline. Social distancing, wear a mask, hand washing, and avoiding being around large groups of people where it's easier to transmit the virus. All of those control measures remain to be important across the entire community. And lastly, I will mention, just because it is of great media interest and we've had questions, I can expect that there will be more questions today. We are working with the University of Memphis to investigate clusters and cases at the University of Memphis. And as of this moment in time, we've been notified by the university of 135 students who have tested positive in August and September. And that does include the students who were part of the athletic teams, but it also includes others. And we continue to work with the university and with those students and with faculty and staff associated with the university to investigate cases, place those who need to be under control measures of isolation into isolation, place those who need to be in quarantine because of exposure in quarantine, and continue to work to bring the transmission associated with the University of Memphis under control. With that, I'm going to turn it over to Director Haushalter for further comments.
Thank you, David, and good afternoon, everyone. I just want to make a few additional comments before I turn it over to our guest. David reinforced the importance of us really adhering to the preventive measures that we've highlighted over and over again. We've come quite a long way over 6 months, but as was anticipated, we are seeing an increase in the number of cases that we are associating with the Labor Day weekend. And it's going to be critical that we strive to contain increased transmission at this point. So those preventive measures that David outlined are really critical. But there are also containment measures that David mentioned briefly. And I want to highlight those specifically today because those are really critical at this point in this juncture in time. It's important that anyone who is aware, so that's a healthcare provider, a laboratory, or an organization, that someone in their organization or a patient of theirs or someone whose lab was run in that particular laboratory, if there's a positive test, that needs to be reported to the health department. That's written in the health directive, but one of the reasons for reporting is so that we can quickly implement isolation measures, begin the contact tracing, and then implement quarantine measures. That way, if we do have transmission, we're able to limit the exponential growth of COVID over time. So really staying on top of that is going to be important. It has been all along, but it's really important at this time so that we continue to move forward. I also want to highlight briefly our decision making and announcements that we may or may not make. I think everyone's aware that I look at things from the incubation periods, and specifically relative to Labor Day, we said we would need to wait at least 14 days to look at any increase in cases relative to Labor Day. But we also know that for individuals who might require hospitalization, that may be another 5 days or so beyond that 14-day period before we see the impact on hospital systems. So we are really looking at the data. Today was pivotal because we had almost 300 new cases. Clearly, the data tomorrow and through the weekend is going to be significant. So we don't anticipate making any formal announcements regarding the health directive until at least Monday, so that we can make sure that we're data-driven at the local level. And lastly, I just want to reinforce that we do have plenty of testing capacity in our community, and the more people that get tested, the more we can identify those individuals who are active cases, and and particularly those who may be asymptomatic. So we do have plenty of capacity across the community, and as David pointed out, for National Latino Heritage Month, we want to make sure that we're really reaching out to the community, offering testing, making it easily accessible, and providing those testing opportunities on the weekend. So today we have with us Mr. Lopez, who's from a local radio station that's going to speak to the community in Spanish, so that ideally everyone can hear the message and access available testing this weekend. Thank you. Mr. Lopez?
Thank you for the invitation. I'm so glad to stay here, and it's so important for the community Hispanic to make a test. And the Shelby County Health Department made 2 events that weekend. It's the Saturday 19 at the 8 a.m. to 1 p.m. in la Iglesia de la Asunción in 3680 Ramil Road, Memphis. The testing will be in the gym. If you are interested to make this, you need to contact Joaquin Espada, 901-485-5912. The second event is on Sunday, September 20, the 1 p.m. for 4 p.m. in the Sagrado Corazon, the 1344 Jefferson Avenue, Memphis, Tennessee. The testing will be in the basement. If you are interested of this, you need to make the contact Javier Rodriguez, 901-726-1891. Es muy importante para la comunidad. Agradezco la invitación del Departamento de Salud del Condado de Shelby en este mes de la Hispanidad. Tener muy claro lo que está pasando en nuestra comunidad. Los números no son buenos para nosotros. Tenemos mucha gente infectada y cada vez los números van en ascenso. Van en ascenso y eso no nos va favoreciendo. El condado de Shelby ha puesto a disposición de la gente de la comunidad hispana en esta ciudad 2 diferentes espacios para que usted pueda hacerse el test del virus del coronavirus. Esto va a ser este fin de semana, el 19 de septiembre, de 8 de la mañana a 1 de la tarde, en la Iglesia de la Asunción, en el 3680 de la Ramil Road, aquí en la ciudad de Memphis. Puede usted hacerlo llegando a través del señor Joaquín Espada al 901-485-5912. También déjeme decirle que el próximo domingo, septiembre 20, de 1 de la tarde a 4 de la tarde, será en el 1324 de la Jefferson Avenue, en la Iglesia del Sagrado Corazón. Y también usted puede contactar a Javier Rodríguez al 901-726-1891. Van a ser 300 pruebas que van a estar dando. También queremos decirle que no se preocupe por el tema de la identidad, no habrá ningún tipo de problema. Sus datos quedarán para usted, no van a ser abiertos al público, solo son para usted. Los resultados se entregarán de 2 a 3 días y también sabemos que los niños se están contagiando. Entonces, si usted quiere llevar a los niños de 13 años en adelante, lo puede hacer. Es muy importante que los niños de la comunidad hispana en este mes de la herencia hispana estén saludables. Les recuerdo, son en 2 lugares este septiembre 19 de 8 de la mañana a 1 de la tarde en el 3680 de la Ramil Road con Joaquín Espada al 901-485-5912 o también el día domingo septiembre 20 de 1 de la tarde a 4 de la tarde en la Jefferson Avenue en el 1324 la Jefferson Avenue al 901-726-1891 con Javier Rodríguez. Es muy importante que usted sepa que también puede comunicarse a la línea de ayuda al 943-1658. Ahí le van a estar dando toda la información que usted requiere en español. Es muy importante, agradecemos a las autoridades por poner atención en nuestra comunidad, que es una de las comunidades que más ha sido tocada. Thank you for the community Hispanic for being here.
And thank you for being here. And we'll open it up for questions.
April Thompson, WREG.
Can you hear me?
Yes.
Okay, I have two questions. The first, I wanted to ask about the testing. You mentioned that you were working with the University of Memphis on their numbers. We have seen a lot of cases come up with sports at the University of Memphis, and now Shelby County Schools has ended all of its sporting activities. Why is it so prevalent you're seeing in sports, and are you providing directives to the schools on what they should do?
Great question. So I want to remind everyone that the governor's office made a decision that any decisions regarding virtual school or in-person school was a school district decision, and also whether or not there are sports or a school district decision or a university decision. So we're not giving directives in regards to whether or not sports can be played. Where we are able to influence is we have said publicly and fairly strongly that we do not think that it's safe at the current time for contact sports. However, if a university or a school opts to move forward with contact sports, we will provide guidance and technical assistance, which is not quite a directive. So it is providing support and TA, but not giving a clear directive. Some organizations do regular testing of athletes, others do not. What we do know is that we anticipate that there will be outbreaks related to contact sports, and that's for a variety of reasons. But as a mother of an athlete, I will say that I know in the football huddle, they're very close to each other. There's a lot of yelling that goes on. There's a lot of close contact that happens, and so it's going to be very easy to expel the droplets and to expel the virus just by the nature of the sport itself. And we know that what we need to do is, one, if you're a parent, make sure your child is as healthy as possible. It's really important that we maintain good health. That will help us have as least amount of illness related to COVID as possible. Make sound decisions about whether or not you want your young child or young adult to play sports, and then to get tested on a regular basis, and whenever ill, to avoid sports. And your follow-up question, please?
Yes, my follow-up question was concerning some of the positivity rates that have been listed and what you all send out on a daily basis. We were looking at some of the numbers, just comparing from last week, and it looks like some of the numbers changed when you look at the mass directive bars closed example. Have you gone back and changed anything and made some revisions on the positivity rates, or why are those numbers different?
So one of the reasons they're different, and David might want to add to my talking points, is that previously we reported the number of individuals who were tested, but we also have information on the total number of tests run, and those are sometimes duplicated tests. So one individual in the community may have multiple tests. We've made a decision to report both of those numbers so that the community has more information and we have more information. We do take that information into context, particularly about our decisions to move forward. I would say personally, I'm not as concerned today about the positivity rate. What I'm concerned about is the increase in the number of cases. We were really at the low 100s. And now we're almost back at 300 today, and that is again related back to Labor Day. And if you remember, after the 4th of July, we saw this sudden jump up, and it continued to go up. So we've got to watch that closely. That's more concerning to me than the positivity rate. And then our reproductive rate is back above 1. We had gotten below 1, and so that's concerning as well. But I'll see if David wants to add to that.
So, yes, so there was a slight change in the percentage because of some new programming and filters on deduplication of data that we introduced once we got a fuller data set of test results. And so we added in the programming that drives those calculations, some increased numbers of filters to hone in more precisely on the number of persons tested and the way we calculate the positive case rate. And that did slightly change the percentage. The overall shape of the curve stayed the same. The relative proportions between bars stayed the same, but some of the specific numbers were altered a little bit by the new filters in the SAS program that drives those calculations. And but now we feel what we're representing is the most accurate picture that we can show. And I think that's the message that I want to get out about the data team, is all throughout this epidemic, going all the way back to March, we're constantly asking ourselves, how can we do better? How can we be more accurate? How can we be more precise? How can we improve the coding underlying the numbers? And so we're never satisfied. And as we try to continue to improve, those improvements sometimes introduce some more refined focus, and the numbers change slightly, but it's more driven by the fact that precision and accuracy is always being increased, and that's a quality improvement goal of ours, to always improve the precision and accuracy of our calculations.
Sam Hardiman, Commercial Appeal.
Hi, my first question, then I'll have a follow-up, is how many of the 135 cases at the University of Memphis are considered accurate, and has the university reported cases to the health department in a prompt manner?
Okay, as far as the cases that, in terms of them being reported, the cases have been reported because by law the laboratories had always report these cases, and so the individuals who have tested positive were already reported in August and September as per normal. What we did not realize was their affiliation with the university. That was not apparent in you can't tell from a laboratory report that that's the case. So that's why we need the assistance of organizations to report cases associated with them, whether that's a business, a social organization, an educational institution, whatever. That helps us connect the dots. But now, as we've gotten that information from the University of Memphis, digging into the clusters and investigations that were going on there, we got an expanded spreadsheet that lists the affiliations of these students with the university, and that makes it easier for us to follow up and hone our questions in our interviews with those students. In terms of
And following up on my first question is, how many are considered active at the university? And then my real follow-up is, will the health department be following the tripwires that were set out in Health Directive 11 when determining what to do about limited service restaurants, also known as bars?
Right. I'll let the director speak to that part of the question. In terms of our, out of the 135, how many would be considered active cases? The ones that would be considered active cases under the new definition of an active case by the Tennessee Department of Health would be cases that have been diagnosed in the last 14 days. But the previously diagnosed cases will still be part of our interview process to just make sure we understand all of the social linkages and potential linkages between cases in the spreadsheet. But in terms of how many of those were diagnosed in the last 14 days, I don't have that number on top of my head. We can get it if it's necessary. But the main thing is that we are getting a good flow of information now between the University of Memphis and the health department, and that we're working to complete that investigation as expeditiously as we can. And for your other question, I'm going to turn it back over to Dr. Haushalter. Thank you.
Thank you, David. And before I answer your tripwires question, I also just want to note something that I've previously noted. One of the limits of the data collection system in the state of Tennessee, but that impacts Shelby County, is there's a challenge in being able to identify and associate a case with a specific location. Our team really has worked diligently to provide not only accurate data to Shelby County, but actually very robust data. So our team has developed additional interviewing tools to be able to more quickly identify those clusters. As I said earlier, containment is going to be, it's been critical all along, but it's really going to be critical at this point that we get those cases quickly and contain the spread so that we can get back to business as usual and back to school as usual. And then your question was about the tripwires. Yes, we will be using the tripwires as our guidance. I will remind you that we focus on all of the measures. There's no one single measure that makes us move forward or backward. And we'll be looking at all of those in context of the data that comes in over the weekend.
Kendall Downing, WMC.
Hey everyone. First question is about nursing homes and long-term care facilities. We've heard from the Tennessee Healthcare Association about concern regarding the state asking long-term care facilities to potentially pay for all the COVID-19 testing themselves. Are you all aware of that? And do you have a comment on that? And then I have a follow-up.
We are aware that there's some changes that are occurring. One change is that CMS, or the Center for Medicare and Medicaid Services, has issued guidance around frequency of testing, and that's based on the case rates per community. So some communities will go to weekly testing, some will remain at twice-a-week testing. And then my understanding is that those facilities should bear the burden of that testing based on feedback from the state. Now, I do understand there's some conversations occurring to see if that will actually be manifest that way or not, but that's my understanding. I also want to just remind everyone that a lot of other institutions do testing. Hospitals have been doing testing quite a bit from the very beginning. Athletic systems also, they're doing testing of their athletes. Some academic institutions are doing testing, and some other businesses are doing testing. And the majority of those cases, those are actually covered by the organization, not the state. So I think there's an attempt to move towards some equity in how those tests are paid for.
And then my follow-up is regarding the Labor Day holiday. At what point, we know after July 4th, there was a substantial increase. The numbers were higher. Do we anticipate that the numbers could get back to that type of level, or do we still believe that some of our transmission methods, preventative methods, would keep us from getting to what occurred here in July again? Thank you.
That's a great question. It's a good ending question. I think with containment, we can reduce the exponential growth of cases over time so that we don't experience what we did in July. But there's some other things that are different now than July. We do know that the lab reporting time has really been reduced significantly, so that if someone tests, that report is going to come to the health department really within a day to 3 days. Everyone's aware we have built up our staff capacity significantly. We hired or posted 141 positions. We have some vacancies there, but we'll also be adding another 70 positions, and those individuals are focused on contact tracing and enforcement, so that when the data comes in, we can quickly begin to work on assuring isolation and assuring quarantine of contacts. With all of that, my thoughts are that we won't get to the place that we were in July. But we do have to continue the course and really stay focused on the preventive measures that were outlined previously. And I would reinforce the specific one of those individuals who are most at risk really should avoid crowds, and as much as possible have others assist them with things like groceries and so on and so forth, and then continue masking, which is going to, I know people get tired of it, but we're going to need to continue to do that for some time to come. And then lastly, remind people to get their flu vaccine.
We're out of time. Are there any closing messages today?
So I want to thank our guests for being here and really encourage people to access testing this weekend, and we'll continue to provide outreach and support. Thank you.
Thanks, everyone. We'll see you next week.